Hi, so I'm Paulina, and I've been volunteering Euro Youth Mental Health since February this year, and I currently live in Germany. I decided to become part of this group and being an expert by expert because I think that one of the most important tasks of our society is to kind of gain further knowledge in the field of mental health support, prevention, and intervention for young people, and especially to kind of give young people the opportunity to understand more about mental health themselves, and in doing so, kind of paving their way of being an adult and growing up.
Brilliant, thank you. And to get started, I wondered if you could tell us how you would describe or how you think of active ingredients.
Yeah, so personally, I kind of think that it's more likely a core process that leads to change when tackling depression and anxiety. It's kind of the best bet of why a particular approach or intervention helps young people. So if we take, for example, a peer support group in a school, it may help to prevent depression and anxiety because, especially because it promotes relationships with the other peoples, and it kind of helps that they learn from each other.
Lovely. And why do you think this project in particular is important?
So we as an organization, we kind of want to ask questions on how to best learn how to support young people. So types of questions being asked, and how they are asked, and this is kind of be needs to be led by young people. So it's really important that the studies get better hearing of voices of young people from all different countries and contexts. So as you might know that, or as I feel like it's kind of traditionally that it's more focused on voices of young people in Western cultures, and we try to get the overall range of different countries, and we're pretty good set up with that, and that the study kind of will be able to realistically hear the voices of young people from groups that might not be heard yet.
And finally, how would you describe what we're trying to do in the project and how will this meet the aims that Wellcome have set out?
So we kind of separated it into two stages. So firstly, we would like to speak to at least two groups of young people and one group of staff. So researchers, PhD, youth workers, petitioners from each identified country. We would like to ask groups what active ingredients mean to them and how they can be described in their own words. So the answer I give beforehand might be different from person to person. And then these 26 active ingredients will be discussed, clarified, and gaps, focusing on which ones are more important or less important given the local context in the country we are talking about. And then afterwards, we would want to do breakout sessions where the groups, like smaller groups, would be asked to rank 26 plus active ingredients. So that's mostly the first step. Secondly, continuing that, we will speak to researchers and policymakers again from these countries we identified beforehand, discussing their views on the active ingredients, and to help bring together all of the different discussions with young people that we have beforehand. And this kind of will helped by a small number of interviews with young people and staff and researchers again, so that we can agree on find a description and prioritize some of the key active ingredients. But I wanted to point out that the project itself would be an international network of young people, and it's kind of seems like for us as a starting point for a peer research network for the future studies and for work on active ingredients. We are really open to a range of areas and that come up in these different discussions and gaps that occur in active ingredients, and how different ones may be related to each other and other things that stop or help an approach to managing depression and anxiety while working with young people. So we're really particularly interested in moving beyond looking at persons and how depression and anxiety are created and managed through society. So in generally, we feel like that anxiety differs in different countries and different cultures, and we want to get to know that. And the questions we really are keen to ask and answer are like, how will all fund, teach, and support young people so that they are empowered to manage depression and anxiety, and how do these needs differ in different countries. And we do really look forward to um, working with the support of Wellcome to find out.
Brilliant. Thank you so much.